friends, today is the fifth death anniversary of Dr. Hammer, the founder of German New Medicine. As we all know, Dr. Rick Gerd Hammer was born on May 17, 1935, and we in our global GNM recently celebrated his 87th birthday as World GNM Day. Today, to commemorate the fifth anniversary of Dr. Hammer, I selected the topic Hammer Focus because Hammer Focus is the one and only evidence available on this planet till date to demonstrate the psychical cause of the physical manifestation. I always admire Dr. Hammer for this discovery. This Hammer Focus will stand the test of time and stand as the concrete evidence of Dr. Hammer's German New Medicine. This information given in this presentation is for educational purpose only. It is not intended to be a substitute for professional medical service. Participants shall consult their medical doctor for health reasons before using anything that is disclosed during the course of this presentation. Students shall not use any of the different information given in this presentation while writing their examination. GNM is a revolutionary science and the most needed knowledge of this era and the ages to come. To acquire a thorough knowledge about German New Medicine, one must make sincere efforts to learn and understand the 5 biological laws of nature postulated by Dr. Hammer. This forms the base of German New Medicine. The diagnosis of testicular cancer shortly after the death of his son Dirk made him think whether the sudden unexpected death of his son could be the reason for his cancer diagnosis, as he was apparently healthy till then. He started analyzing the medical records, personal histories, and the brain scans of his patients. All bodily processes are controlled from the brain. So, Dr. Hammer analyzed his patients' brain scans and compared them with their medical records and personal histories. So, now he has CT brains of cancer patients, medical records of cancer patients, and personal history of cancer patients. And this personal history is what is missing in today's modern science or in the conventional medicine. So Dr. Hammer found a clear correlation between certain type of conflict shocks, how these conflict shocks manifest themselves on the organ level as specific symptoms, how all this is connected to the brain. Until then, no studies had examined the role of the brain as a mediator between the psyche and a diseased organ. Psyche communicates with the organ through the mediator or the controlling station called brain. Dr. Hammer found that conflict shock or emotional distress, which is sudden, unexpected, and catches the individual off guard, is the cause of every so-called diseases. So, from the personal history, he understood the psyche, that is the DHS or the conflict shock encountered by the patient. From CT brain, he was able to determine the brain relay which was affected by the conflict shock and from where the corresponding organ is coordinated. So, from the medical records, he was able to find the signs and symptoms encountered by the patient. So, psyche, the subconscious mind, operates a body, that is a physical body, through the mediator called brain. This Dr. Hammer called his new discovery as German New Medicine. In an unexpected, emotionally traumatizing event like death of his own son, can you imagine a person to make a scientific journey and analyze why it happened, how it happened and all? Usually people stumble and sob, but only blessed and determined persons like Dr. Hammer can convert the pain into a wonderful knowledge for mankind which can stand the test of time. So this is a revolutionary discovery because till date we do not have any evidence to demonstrate the psychical cause and its effect on the material body. It is the geniusness of Dr. Hammer who could demonstrate the immaterial psychic causal effect on the material body. I wish to share the history behind the name Hammer Focus. He is a controller of our body through the mediator called brain. So, if we want to prove that the psyche is a cause of the physical diseases, we must look for some changes or proof on the brain too. This was the idea of Dr. Hammer, and that is why he started analyzing the brain CT scans of all his cancer patients. By analyzing the CT brain scans, he could find that patients with specific conflict had concentric ring configuration in specific area in the brain, which is the relay center of a specific organ. So Dr. Hammer was keen in analyzing the brain scan and was looking for this ring configuration in the brain CT scans. The opponents and the ridicules of Dr. Hammer was making fun of him for focusing on this ring configuration on the scans. So they started calling the concentric ring configuration findings of Dr. Hammer as Hammer Focus, as Hammer was focusing on it. Actually, it was a ridicule on Dr. Hammer. Oscar Wilde says, ridicule is a tribute paid to the genius by the mediocrities. I also wish to quote author here. All truths passes through three stages. First, it is ridiculed. Second, it is violently opposed. Third, it is accepted as being self-evident. The truth called German New Medicine also passed the three stages. First, when Dr. Hammer found it, it was ridiculed. Then, throughout the life of Dr. Hammer, it was violently opposed. Now, after his time, it is accepted worldwide, and our World GNM Day celebration itself is a proof for that. These concentric rings were ignored as artifacts created by a glitch in the machine. But in 1989, the CT machine manufacturing Siemens certified that these cannot be artifacts as the rings appeared in the same location even when the CT is repeated from different angles. So, Hammer Focus became the ultimate diagnostic tool in German New Medicine. Location of Hammer Focus implies or gives us the details about the nature of DHS and the organ affected. Size of the ring implies the intensity of the conflict. Sharp rings means conflict activity. Swollen and edematous rings means the patient is in the first part of the healing phase, that is a PCLA phase or exudation phase. So rings surrounded by glial cells means the patient is in the second phase of the healing phase, that is a PCLB phase, the scarification phase. So here I request all the viewers to watch my second biological natural law of German New Medicine video available in the same channel for understanding about conflict active phase, healing phase, and other things mentioned in this slide. So Hammer Focus can be more than one in number in a single person too, and every Hammer Focus implies the above information to us. So they are called as conflict markers. Only proof that the psyche communicates with all organs of the body through the mediator called brain, which is a control station from where all the so-called disease manifestations are coordinated. Hammer Focus not only stands as a proof of German New Medicine, but also shatters lots of myths fed into our brains through the conventional medicine. So let's see how the CT brain is taken. The CT brain is taken without contrast from the base of the brain, and the images are viewed from the perspective of the individual, meaning right side of the scan means right side of the brain. Left side of the scan means left side of the brain. Hammer Focus added value to German New Medicine as it is able to demonstrate the psyche's effect on the body through these CT scans. So now I will be presenting all the conflicts briefly and this will be like in reference for all the viewers. So, brain relay can be broadly classified into three: brainstem, cerebellum, and cerebrum. Cerebrum is further divided into cerebral medulla and cerebral brain scan. So, temporal lobe, cerebral hemisphere will be seen in the scan like this. So this is the frontal lobe, temporal lobe, midbrain, fourth ventricle, cerebral hemisphere, falx cerebri, frontal lobe, parietal lobe, occipital lobe. So for non-medicos, I have given few slides of the brain CT scan so that you will understand the different parts of the brain as seen in the CT brain. So we classify all the organs and tissues in our body into three from the embryological point of view as endoderm derivatives, mesoderm derivatives, and ectoderm derivatives. So this is the tricolor of German new medicine. Yellow represents endoderm, orange represents mesoderm, red represents ectoderm. They are the germinal layers from which our human organism developed. So let's see the brief embryology in nutshell. Three germ layers: endoderm, mesoderm, ectoderm. Mesoderm again has two components: old mesoderm and new mesoderm. Endoderm derivatives are primitive function related organs like lung, digestive tract, kidneys, testes, ovaries, etc. These are the primary functions even found in single cell organisms, that is the respiration, digestion, reproduction, excretion, and all comes under this endoderm derivatives. Mesoderm derivatives are divided into two: old mesoderm and new mesoderm. Old mesoderm derivatives are skin and coverings. So we have corium, skin, pleura, peritoneum, pericardium, breast glands. So pleura is a covering of the lung, peritoneum is a covering of the abdominal organs, pericardium is a covering of the heart. So new mesoderm derivatives are supportive system, that is the bone and joints, muscles and connective tissues. So ectoderm derivatives are advanced functions related organs like milk ducts, thyroid ducts, pharyngeal ducts, bile ducts, pancreatic ducts, gallbladder, urinary bladder, renal pelvis, ureters, cervical and rectal mucosa, etc. etc. Now the viewers, especially the non-medicos, may ask me, why should I learn the three germ layers and the organs derived from them? To know the pattern of the SBS with the help of German New Medicine Compass, we must know the embryology, at least the basics. To predict the pattern of the SBS, whether the patient is in conflict active phase or he is in healing phase, or what is expected next. If we want to expect and predict, we must know the germ layers and the organ derived from them. To shatter the existing myths in conventional medicine. To prepare oneself for the healing symptoms. So organs controlled from the brainstem are pituitary glands, pineal glands, choroid plexus, tear glands, choroid, iris, ciliary body, middle ear, eustachian tubes, mouth and pharynx submucosa, lung alveoli, goblet cells, thyroid gland, parathyroid gland, esophagus, that is a lower third of the esophagus, stomach, that is a greater curvature of the stomach, duodenum, liver parenchyma, pancreas glands, small intestine, colon, sigmoid colon, rectum submucosa, kidney collecting tubules, adrenal medulla, bladder submucosa, that is a trigone submucosa, prostate gland, smegma secreting gland, uterus and fallopian tubes, Bartholin glands. Let's see the specific conflicts related to these organs controlled from the brainstem. Pituitary gland, master conflict. Pineal gland, sudden long darkness conflict. Choroid plexus, muscle conflict, or the brain is too dry. Tear glands, conflict related to a visual muscle. Choroid, conflict related to a visual muscle. Iris, conflict related to a visual muscle. Ciliary body, conflict related to visual muscle, middle ear, conflict related to a sound muscle, eustachian tubes, conflict related to a sound muscle, mouth and pharynx submucosa, muscle conflict. Lung alveoli, it is a death flight conflict, goblet cells, fear of suffocation, thyroid gland, muscle conflict, parathyroid gland, muscle conflict, esophagus, there is a lower third of the esophagus not being able or not being allowed to swallow a morsel, stomach, greater curvature of the stomach, indigestible muscle conflict, duodenum, indigestible muscle conflict, liver parenchyma, starvation conflict, pancreas gland, indigestible muscle conflict, small intestine, not being able to digest or absorb a morsel, colon, indigestible muscle conflict, sigmoid colon, feces conflict, rectum submucosa, feces conflict, kidney collecting tubules, abandonment conflict, existence conflict, refugee conflict, hospitalization conflict, adrenal medulla, unbearable intense stress, bladder submucosa trigone, ugly dirty muscle conflict, prostate gland, procreation conflict, sexual conflict, gender conflict, smegma secreting gland not being able to penetrate a tight or dry vagina, uterus and fallopian tubes, procreation conflict, implantation conflict and gender conflict, Bartholin's glands not producing sufficient vaginal mucosa. So I have summed up all the conflicts of brainstem controlled organs here. So if you want to categorize them, we could see clearly that it is all related to muscle conflict, that is food and food related things, visual muscle, sound muscle, and other muscle conflicts, and excretory system related, feces conflict, ugly muscle, ugly conflict, dirty muscle conflict, and it is about the survival, abandonment conflict, existence conflict, refugee conflict, hospitalization conflict, and it is related to survival. Once again, death fray conflict, fear of suffocation, unable to breathe, that is respiration related things, and reproduction related conflicts are procreation conflict, sexual conflict, implantation conflict, not being able to penetrate a tight vagina or a dry vagina, not producing sufficient vaginal mucosa in females. So these are all the basic 10 primitive functions of all the organisms. So morsel conflict related to digestion, respiration, excretion and reproduction. These basic conflicts are controlled from the brainstem, and these are all the endoderm derived organs. Organs controlled from midbrain are pupil muscles, ciliary smooth muscles, intestinal muscles, sigmoid and rectal muscles. There is a upper rectum, internal rectal sphincter, internal bladder sphincter, uterus muscles, female germ cells, male germ cells, atria of the myocardium. So the specific conflicts related to the organs controlled from the midbrain are light related muscle conflict in case of pupil muscles, not being able to see what is close in case of ciliary smooth muscles, not being able to pass an indigestible muscle in case of intestinal muscles. Sigmoid and rectal muscles are related to feces conflict, not being able to hold back feces is related to internal rectal sphincter. Not being able to hold back urine is related to internal bladder sphincter. Not being able to hold the fetus is related to uterus muscle. Profound loss conflict is related to female germ cells and male germ cells. Not being able to move the blood morsel is related to the atria of myocardium. I have summed up all the conflicts related to organs controlled from the midbrain. So now we can see clearly that this midbrain controlled organs have a component of inability or not being able to component in the conflicts. Organs controlled from the cerebellum or myelin sheath, as I already told you, cerebellum means we use this orange color. So organs controlled from the cerebellum or myelin sheath, eyelid glands, pleura, peritoneum, great omentum, tunica vaginalis testis, breast glands, corium skin, pericardium. We shortly say it as skin and outer covering. So the conflicts, specific conflicts related to this cerebellum controlled organs are myelin sheath is related to touch conflict, eyelid glands is related to attack against the eye or disfigurement conflict, pleura is related to attack against the chest, peritoneum is affected by the attack against the abdomen conflict, tunica vaginalis testis is related to the attack against the testis conflict. Breast gland is related to nest worry conflict or argument conflict. Corium skin is related to attack conflict, disfigurement conflict, feeling soiled conflict. So the conflict related to pericardium is attack against the heart. So I have summed up all the conflicts of the organs controlled from the cerebellum. So we could clearly see that it is all about the attack and protection. So the function of the organ is directly related to the conflict theme. So we could see that very clearly in this slide. Organs controlled from the cerebral medulla are ear cartilage, kidney parenchyma, adrenal cortex, testicles, corpora cavernosa, ovaries, spleen, endocardium, heart valves, dentine and jawbone, striated muscles, connective tissues, fat tissues, bone and joints, tendons, cartilages, lymphatic vessels and lymph nodes, blood vessels, arteries and the veins. So the specific conflicts related to the organs controlled from the cerebral medulla are self-devaluation conflict in case of ear cartilage, water or fluid conflict in case of kidney parenchyma, having chosen the wrong path in case of adrenal cortex, loss conflict in case of testis in males, corpora cavernosa is related to self-devaluation conflict again, ovaries are related to loss conflict again, spleen is related to bleeding or injury conflict, endocardium is and heart valves are related to self-devaluation conflict. So striated muscles are also related, striated muscles, connective tissues, fat tissues, bone and joints, tendons, cartilages, lymphatic vessels and lymph nodes, arteries of the blood vessels, everything is related to self-devaluation conflict only and are related to ball and chain conflict. Dentine and jawbone are related to bite conflict. So if we sum up all the conflicts related to the cerebral medulla controlled organs, we get the biggest self-devaluation conflict, and apart from that we have this fluid or water conflict, loss conflicts, bite conflict, ball and chain conflict, bleeding or injury conflict, having chosen the wrong path. So before seeing about the cerebral cortex, we will see this functional areas of brain, motor area, sensory area, frontal lobe, Broca's area, that is a speech controlling area, temporal lobe, that is related to the hearing, language and memory, and parietal lobe, occipital lobe, these are all the functional areas of cerebral cortex. Apart from that, we have organs controlled from the cerebral cortex. Before seeing them, we will be seeing the cerebral cortex is divided into frontal lobe, temporal lobe, motor cortex, sensory area or the parietal cortex, visual cortex or the occipital lobe. The cerebral cortex is divided into premotor sensory cortex or frontal lobe, motor cortex, sensory cortex or parietal lobe, post-sensory cortex, visual cortex or occipital lobe. So premotor sensory cortex, motor cortex, sensory cortex or parietal lobe, post-sensory cortex, visual cortex or occipital lobe, I have shown in the previous slide. So these are all the organs controlled from these organs. So we must note that glucose center is controlled from the diencephalon and not from the cerebral cortex. So organs controlled from the cerebral cortex are excretory tear ducts, eyelid gland ducts, outer eyelid skin, conjunctiva, lens, cornea, nasal mucosa, paranasal sinuses, larynx mucosa, bronchial mucosa, trachea, pharyngeal ducts, mouth and pharynx submucosa, surface mucosa, throat, salivary gland ducts, thyroid ducts, esophagus. There is an upper two-third of the esophagus. We already saw that lower one-third of the esophagus is not related to cerebral cortex. We must know this difference. And previously we saw that the greater curvature of stomach and its conflicts. So now in cerebral cortex, we have the smaller curvature is controlled from the cerebral cortex, and the pylorus, duodenal bulb, bile ducts, gallbladder, pancreatic ducts, rectal surface mucosa, perianal ducts, renal pelvis, ureters, bladder, urethra, prostatic ducts, glans penis, milk ducts, cervix mucosa, vaginal mucosa, clitoris, epidermis, enamel of the T, coronary arteries, coronary veins, aorta, subclavian arteries, carotid sinus, retina, vitreous body, cochlea, that is the inner ear, vestibular organ, that is also in the inner ear, periosteum. So now we will see the specific conflicts related to the organs controlled from the cerebral cortex. Tear ducts, wanting to be seen or not wanting to be seen. Eyelid glands, visual separation conflict. Conjunctiva, visual separation conflict. Lens, visual separation conflict. Cornea, visual separation conflict. Nasal mucosa, scent conflict, stink conflict. Paranasal sinuses, same scent conflict and stink conflict. Laryngeal mucosa, scare fright conflict or territorial fear conflict. Bronchial mucosa, territorial fear conflict or scare fright conflict. Trachea, not getting enough air. Pharyngeal duct, frontal fear conflict or powerless conflict. Mouth and pharynx surface mucosa, oral conflict. Throat, not wanting to swallow a morsel. Salivary gland duct, not being able or allowed to eat. Thyroid ducts, powerless conflict or frontal fear conflict. Upper two-third of esophagus, not wanting to swallow a morsel. Smaller curvature of stomach, pylorus, duodenal bulb are all related to territorial anger conflict or identity conflict. Bile ducts, gallbladder are also related to territorial anger conflict or identity conflict. Why this are given means because the conflict varies with gender and hormonal status and the handedness of the person. We will be seeing these things in detail in future. Pancreatic ducts, territorial anger conflict or identity conflict. Rectum surface mucosa related to identity conflict or territorial anger conflict. Perianal ducts related to not being able to eliminate feces fast enough. Renal pelvis and ureters are related to territorial marking conflict. Bladder and urethra are related to territorial marking conflict. Prostatic ducts are also related to territorial marking conflict. Glans penis is related to separation conflict or penis conflict. Cervix mucosa is related to sexual conflict or mating conflict. Vaginal mucosa is also related to sexual separation conflict. Clitoris is related to separation conflict, clitoris conflict. Milk ducts are related to separation conflict. Epidermis related to separation conflict. Enamel is related to bite conflict, not being allowed to bite. Coronary arteries are related to territorial loss conflict or sexual conflict. Coronary veins are related to sexual conflict or territorial loss conflict. Aorta, carotid arteries, subclavian arteries are all related to territorial loss conflict or sexual conflict. Carotid sinus is related to blood pressure is too high conflict. Organs controlled from the cerebral cortex which respond to the DHS with functional changes or functional loss are retina, vitreous body, cochlea, vestibular organ, and periosteum. So we will be seeing the specific conflicts related to them. Retina, it is a fear in the neck that cannot be shaken off. Vitreous body, it is a fear of a predator. Cochlea, it is a hearing conflict. Vestibular organ, it is a balance conflict or falling conflict. Periosteum, it is a severe separation conflict. So I have summed up all the conflicts related to cerebral cortex here in this and categorize these conflicts like this. Sexual related things, territory related things, fear and fright related things, not wanting to or wanting to do something, biting, falling, balancing, hearing, scent, stink, everything. So organs controlled from the cerebral medulla and from the motor cortex together are eyelid muscles. Eyelid muscles are levator palpebrae, orbicularis oculi, ciliary muscles, striated ones, extraocular muscles. So levator palpebrae is related to not being able to keep the eyes open. So the conflict related to orbicularis oculi is not being able to close the eyes. Ciliary striated muscles are related to not being able to see what is in the distance. Conflict. Extraocular muscles are related to not wanting or not being allowed to look in a certain direction. Conflict. Stapedius muscle is related to, that is the ear muscle, it is related to noise conflict. Laryngeal muscle, that is a voice related muscle. So it is related to scare fright conflict or territorial conflict. Bronchial muscle, it is related to territorial fear conflict or scare fright conflict. So diaphragm, it is a dome-shaped organ separating the thoracic and abdomen organs. So diaphragm conflict is not being able to breathe sufficiently. Physical overwhelmed conflict. Tongue is related to not being able to pull the tongue away. Esophageal muscle is not being able to regurgitate a muscle. Rectal muscle, that is a lower rectal muscle, and external rectal sphincter conflict is not being able to sufficiently mark the territory. Cervical muscle, cervical sphincter are related to not being able to sufficiently hold the fetus. Bladder muscle, external bladder sphincter are related to not being able to sufficiently mark one's place. Skeletal muscles are related to motor conflict of not being able to move, feeling stuck. Jaw muscles, it is self-devaluation again. So myocardium, that is the ventricles, are related to overwhelmed conflict. So now let's see the organs controlled from the diencephalon, and these diencephalon controlled organs also respond with functional changes or functional loss during the SBS. So alpha eyelid cells or the glucagon center, beta eyelid cells or the insulin center, right and left lobe of the thalamus, right and left of the olfactory nerves are all controlled from the diencephalon. So the conflict, the specific conflict related to these organs are eyelid cells are related to fear disgust conflict or resistant conflict. In case of thalamus, it is a complete self-abandonment conflict. In case of olfactory nerve, it is a not being able to smell something or someone conflict. Hope this video is useful to everyone and everybody will be using this video if everybody enjoyed this video. And I prepared this video with the intention of making it a reference for all the viewers so that they can get the brief understanding about the embryological germ layer of every organ and the control centers and the specific conflict related to them. If you like the video, please share it with your friends and subscribe to our Global GNM channel. Thank you.